Hello all, today we are going to discuss about Glucagonoma Syndrome. I am Mrs. Golden, working as tutor in M College of Nursing. So objectives, at the end of the class we will be able to see about what is Glucagonoma Syndrome, the causes, diagnosis, pathophysiology, signs and symptoms, treatment methods and nursing management of Glucagonoma Syndrome. Introduction. Glucagonoma syndrome is a rare, slow-growing neuroendocrine tumor that occurs in the pancreas and arises from the alpha cells of the islets of Langerhans. So these tumors occur when there is an excessive secretion of the hormone called glucagon and leads to a clinical feature known as Glucagonoma syndrome. Definition. Glucagonoma syndrome is a rare tumor that occurs in the islet cells of the pancreas and leads to an excess secretion of the hormone glucagon in the blood. So it is a malignant pancreatic neuroendocrine tumor which results in the metabolic disturbances like diabetes mellitus, necrolytic migratory erythema, weight loss and anemia. So this syndrome originates from the alpha 2 cells of the pancreas. So this tumor occurs exclusively in the pancreas, but these cancer cells can also spread to the liver. It is characterized by rashes which appears on the head, shoulders, knees and toes, and typically it targets the feet, abdomen, buttocks, face and legs. Causes. The causes are unknown, but if there is any family history of the syndrome called multiple endocrine neoplasia type 1, it is a tumor syndrome. So this type of tumor syndrome is one of the risk factors in the family. And sporadic pancreatic neuroendocrine tumors, which are the most common risk factor, and when there is any pancreatic alpha cell hyperplasia, that also is one of the risk factors for this type of syndrome. Pathophysiology. Tumor arises from the alpha cells of the pancreas which leads in the excessive secretion of the hormone called glucagon. So when there is the excessive secretion of glucagon, it results in increased gluconeogenesis and glycogenolysis, which results in increased lipolysis and protein catabolism. So when there is the increase in lipolysis, it results in depletion of amino acid, zinc and fatty acids, which leads to characteristic skin lesions, hyperglycemia and finally weight loss. Clinical manifestation. So the dermatological manifestations are necrolytic migratory erythema, that is NME. This is a feature of Glucagonoma syndrome. So it is characterized by painful erythematous blistering rashes, and the common sites where it appears are perineum, groin, buttocks, lower abdomen and face. So these lesions heal with hyperpigmentation. And the metabolic symptoms are diabetes mellitus, which ranges from mild to moderate symptom, hyperglycemia and glucose intolerance. So the gastrointestinal symptoms are weight loss, diarrhea, glossitis and angular stomatitis. Hematological symptoms are normocytic or macrocytic anemia and thromboembolic tendency, which results in deep vein thrombosis. And the psychiatric, that is the neuro symptoms, results are depression, irritability and confusion. Diagnostic measures. Lab investigation includes elevated fasting plasma glucagon, which ranges from 500 to 1000, hyperglycemia, low amino acids level, which is known as hypoaminoacidemia, and anemia, low zinc and fatty acids. And the imaging studies are contrast enhanced CT scan of the abdomen, MRI, endoscopic ultrasound and PET scan. Management. So medical management includes somatostatin analogs, which consists of octreotide, lanreotide. These two drugs results in the reduce of glucagon secretion. We can also take insulin or oral hypoglycemic agents, nutritional supplements like amino acids, zinc and fatty acid, anticoagulants for the thromboembolism prevention, antibiotics for the secondary skin infections are the medical management. Surgical management. So surgical management varies according to the treatment of choice. So there are surgical management like surgical resection of tumor, that is distal pancreatectomy or splenectomy. So when there is a management of metastatic disease, that is when the disease has been metastasized, then we can do hepatic resection or ablation, transarterial chemoembolization, peptide receptor radionuclide therapy, targeted therapy like everolimus and sunitinib. Coming on to the nursing assessment. So the nursing assessment includes monitoring the blood glucose levels of the patient, assess the skin integrity and the lesions, monitor the nutritional status and weight, assess for the signs of thromboembolism. Coming on to the nursing interventions, administer the prescribed medication, maintain the skin hygiene and the wound care, provide high protein and high calorie diet, monitor the intake and output chart for the patient, provide psychological support. Patient education. So the health education that is to be given to the patient are the importance of medication adherence, blood glucose monitoring, skin care and infection prevention, and what are the follow-up visits. Thank you all.